Hello guys, once again Ijaz Hidayat is with you, and today we are going to talk about the role of the perfusionist in ECPR activation. So guys, you need to understand what is the ECPR. ECPR stand for extracorporeal cardiopulmonary bypass resuscitations. So today we're going to talk about and we're going to discuss about the role of the perfusion at the time when we get a activation in ECPR. So what are our today's objective? The objective of today is we are going to understand, we're going to learn what was the preparation for the ECPR as a perfusionist, what are the equipments and disposable we required for ECPR, of course manpower and management during the scene. So today's talk will be very interesting, and it is something learning for you and it's something learning for me. So we'll try to understand, we'll try to highlight the role of the perfusionist, especially for the activation of the ECPR. So ECPR is the procedure in which we try to save the patient's life when your resuscitations is unsuccessful, where your CPR is not beneficial to the patient. So we activate with the ECPR. So first of all, we need to understand about no flow, low flow, and full flow. So once you understand no flow, low flow, and full flow, then you can understand the main idea behind the ECPRs. So as we know, as we are the medical professionals, and we know if you get a cardiac arrest and no flow is acceptable for only for the 4 minutes, and low flow is acceptable for like 40 to 60 minutes, and full flow we need to achieve a full flow within 60 minutes. So the ECPR activation safest period we have 45 minutes. So once the team activate the ECPR, so we have the safest time is like 45 minutes, because first 10 to 15 minutes they're trying to do the CPR by themselves, and if they are unsuccessful then they activate the team for the ECPR. So you have ideally 45 minutes. Within this 45 minutes you have to achieve from no flow to low flow, and from low flow to full flow you have only 45 minutes. So within 45 you have to cannulate the patient, you have to connect the patient from no flow to low flow to full flow with the help of your extracorporeal circulation. So today, as I mentioned, the objectives, we have the preparation of the ECPR kit, equipments and disposables, manpower, and the scenarios and your activations. So let's talk. So preparation of the ECPR is we have the ECMO trolley with the ECPR kit, and we have always keep the primed machines. So we don't want to lose not a second to just priming the circuit. So we always keep a primed circuit ready, because the life of the primed circuits we have 1 month. So 30 days is enough for the priming of your circuit. So if you prime your ECMO machines, so it is valid to activate for the ECPR like for within 30 days. So ECMO trolley should be ready. So you should always be ready with your insertion kit, with your cannulas, with the needles, with the guide wires. So we have to prepare the ECPR kit. So we need to prepare the equipments. So equipments mean we have primed cardiovascular machine, or we have the primed machines, ECMO machines. We required at least 4 tubing clamps. We need a heater cooler system which was connected with the line adapters. We need a spectrum monitors with the 1/4 inches flow sensors. We need a gas blender, and we need a full oxygenator cylinder, filled one. So once we initiate, so these things are available as a backup and ready to initiate a proper ECMO program. So what are the disposable we required? We need at least 17 or 15 French arterial cannula for return site. We need a venous cannula like a 21 or 25 French. We required a distal perfusion cannula from 6, 7 or 8 Frenches, different sizes. We required a pink needle for puncturing. We need a dilator set. We required a guide wires 80 centimeters, 145 centimeter or 180 centimeters with a diameter of 0.35 millimeter. And of course, last but not least, we required a de-airing kit. The manpower for ECMO cannulation is the perfusionist. So in ECPR we have a multidisciplinary teams based on your ECMO physician, ECMO nurse, ECMO perfusionist. Clear? So the role of the perfusionist is to take care of your ECMO console. What are the management during the scene? The positioning of ECMO machine it depends on the situation. Where are you? Either you in a cath lab, CT ICU, or in the operating room. Arterial canal insertions with the guide wire of 145 centimeters, and you have to confirm the size before opening, because it can make a big mess in case you give an 80 centimeter guide wire and you are giving like a 60 centimeter long cannula, and you will get a big trouble. So before opening your guide wire, confirm with your physician, confirm with your nurses, and open and speak loudly that I'm opening 145 centimeter guide wires. For the arterial cannula and for the venous cannula, you use 180 centimeter guide wire. Even 145 centimeters is also enough for both cannulas. ECMO initiations, and then we have to do the ACT and blood gas. And then later we do the distal perfusion cannula, and where you require 80 centimeter guide wires. No need for the long guide wire. Even somewhere some of the cannula, distal cannula, having their own guide wires available. But in case you don't have this, so keep 80 centimeter guide wire with the half-inch tubing piece, so you can monitor the distal perfusion of the vision. So the take-home message for this ECPR is ECPR equipment readiness. ECPR equipment's readiness and crucials, clearance, communication. Assist the communication should be very effective. Take the control of your ECMO systems. Focus and calmness for the best result. Okay, the time of the ECPR, this is like a panic situations where everyone was trying to save the patient's life. So in these situations, there should be one team leader, and there is a role divided by the team leaders. Like perfusionist have its own role to take care of the console, cannulas, guide wires. Nurses have their own role to assist to the physician or the surgeon the time of cannulation, and intensivist and the nurses, bedside nurses, have their own roles in case of the ECPR, in case of ventilation, so to maintain the patient's ventilation from a ventilator side. Meantime, we start our ECPR or ECMO activation, ECMO initiations. Guys, keep in your mind, when you are going for the ECPR, you should make one ECPR kit with the 2 guide wires 140 centimeters, and the diameter should be not less than 0.35 millimeter. 80 centimeter guide wire with the same diameter, 0.35 mm. Pink needle at least 2. Always keep 2 access cannula, 2 return cannula, so in case of any contaminations, you have the alternative, and you have the backup cannula available with your ECPR kit. Then try to design your own ECPR trolley, which will going to help you in case of emergencies. The ECPR can be inside the hospital and outside the hospitals. So if there is the inside the hospital ECPR activations, like you are in operating room and ECPR activated, so you have the trolley. And in the hospital, you can move this ECPR trolley either in ICU, OR, cath lab, SDU, HDU, critical care areas. But if your patient is out of the hospitals, so then you always prepare your retrieval bags. So retrieval bag containing your tubes, connectors, cannulas, insertion kit, dilators, and cylinders, oxygen cylinder, insertion dilators. Then you, of course, you need a console, disposable kit, disposable HLs, oxygenators, and the tubing clamps. Don't forget the tubing clamps even. So guys, the ECPR is the procedure where every multidisciplinary individual team have their own role. As a perfusionist, we are responsible for the prime ECMO circuit, we are responsible for insertion kit, we are responsible to provide suitable cannulas as arterial and even the return. Arterial mean return, and venous mean access cannula, because in activation mostly we have the VA ECMO activations, because sometimes we do the VV ECMO also, or sometimes we change the frequency of the cannulas like VAV or VVA cannulas. So always keep a backup venous cannulas and arterial cannulas with you. I'll keep different sizes of your distal perfusion cannulas. Keep your ACT machine with you initially. From the nurses side, they're always keeping their drugs, medicines, heparin, anticoagulants, and some solutions like normosaline, plasmalites, bloods are with them. We have the proper checklists, intra-hospital retrieval or out-hospital retrieval checklist. So before moving from your place to another place, always do the checklist. And ECPR activations mostly depend on one nurse, one perfusionist, and one intensivist, or you can one surgeons. It depends on either is a surgeon or intensivist or anesthetist. So ECPR team is based on three main pillars like a nurse, perfusionist, and the intensivist. So guys, create your own hospital checklist, retrieval checklist. Make your own hospital ECPR trolley. So in case of any activations, you just move your trolley and provide all required medical surgical stuff, and be ready for any emergency, and always keep a backup items available. So guys, if you have any queries related to ECPR, please don't hesitate, ask me question, I will try to answer you. At the end of this my talk, my message for you is, if you like the video, share it, like it, comments, ask questions, and share your experience about the ECPR, and have a nice good day. And guys, waiting for your positive response, and hope my these efforts will give you some benefits. Have a nice and good day.